Thank you very much. Representative Anthony Weiner here, Betsy McCaughey, former New York State Lieutenant Governor, chairman of the Committee to Reduce Infection Deaths, which is a nationwide educational campaign to stop hospital-acquired infections, joins both of us. And Betsy, I want to begin with you, and I'm honestly most interested in what you would want to see. Again, forget debating this particular piece of legislation. I'll ask you the same question I asked Dr. Frist when he was here earlier. What core values would you emphasize to Representative Weiner or anybody else if, in fact, you were going to try to reform health care?
Well, first and foremost, I want to see the uninsured covered, and I've put forward proposals to do that. No one should lose a home or a lifetime of savings because they get sick. Secondly, I'd like to create high-risk pools in the states that don't have them so that people who have pre-existing conditions could get affordable health insurance. It's working in some states. We should have it everywhere. I'd like to stop insurance company abuses so that people who have paid their premiums don't get dumped when they get sick. But I also want to preserve the excellence of American medical care and the pace of innovation, because right now, if a woman gets breast cancer in the U.S., she's got over a 90% chance of surviving. In Europe, it's below 80%. The U.S. has won more Nobel Prizes in medicine and physiology in the last half century.
And I'm stopping you not because I disagree with you, but in the interest of time, I don't think anybody contests. I don't think Anthony Weiner or anybody else would contest the excellence of our health care at its highest output. It's more issues of cost and accessibility that we're debating.
Well, those statistics reflect the outcomes for all patients, not just those with insurance.
Understood. That goes without contest. But again, Dr. Frist, when he was here, argued that the best way to do that is to have choice, to have more competition, to have more opportunity.
A public option does not do that.
Well, again, a public option sounds like it could do that if it was deployed one way. It may not do it if it was deployed another way. There's 10 ways at it. But if the objective is to get choice, competition, and opportunity, accessibility, all the values that you are very much aware of, how do you reconcile, again, where we are in the debate today and where we need to be in the debate relative to, I suspect you don't disagree with much of what she just said.
Well, in fact, the stuff that Betsy just outlined, that's the relatively easy part. The hard part, and that never gets addressed here, is the cost containment part. You know, your insurance policy, mine, are going to go up $1,000 in the next year. We know that based on the last couple of years. We know that people are hiring fewer people because 30% of their payroll is health care costs. We know that things like the amount of money that we're dumping into health care is twice as much what any other country does. So the issue then becomes, how do you do it? Now, you know, I've argued on your show before, I think we should have a plan like Medicare for all Americans, but the president's not proposing it. All we're saying is we should have a sliver of competition, that to help keep these insurance companies honest, give people an option that they can go to that have low overhead, won't have advertising, won't have the other things.
But they're not even doing that. The public option as it's set up right now, I mean, I watched this debate, and I'll say this to both of you. I suspect I can get you both to agree on this. I watched this debate, and they did not offer real choice or competition for most of us. I mean, whether if you are among the individuals, which is most people on an employer-based plan, who would want to bring real market, real choice, real competition.
100%. Dylan, you are making a fundamental point here that gets missed, and that is we're all making way too much about the strength of this public option. I think it needs to be much stronger. You know, if you already have private insurance, your employer, you are not going to be able to go into that public option plan. All it is a very tiny sliver of competition. But one thing the CBO does say, if you want to have cost containment in this bill, you have to have it.
You are missing the major issue. The major issue is that these bills are a medical assault on seniors. Covering the uninsured is an important goal.
I want to talk about. No, I want to talk about that.
We're going to run out of time.
No,
and seniors need to know what's going to happen.
And I'm going to do that. But first, I want to address the. I agree with you, but I want to address the cost issue first. How do you reconcile the fact that health insurance companies have an antitrust exemption right now? You've got 80 or 90% of the market in a lot of states in this country that have only one provider, so there's no competition. You've got an effort by Ron Wyden, Olympia Snow, others trying to create real choice for all of us to participate in exchanges, and the Senate can't even bring that sort of thing to a vote.
Because
how do you manage for costs?
Yes,
forget the public option. You bring in whatever plan you want. I just need cost containment.
Number one, we have to have tort reform in New York.
I disagree with you because that's as a percentage. But you can finish after I make the point that as a percentage of an incremental cost, tort reform is a very minor percentage of the cost.
Not true in New York State. Not true in New York.
In the country,
Bronx,
it is true.
Yes, it is true in some parts of the country. In the Bronx, for example, it adds 10% to the cost of medical medical care, 5% in medical liability insurance, 5% in defensive medicine.
Why would you start with tort reform when you have an antitrust exemption for health insurance companies and a politician's...
You asked me for a list, and I'm not finished.
Well, let's start with the biggest chunk. But let's start with the biggest chunks of meat. It's not statistically. It's just not.
Well, and by the way, the CBO was already... Hold on, Dylan. Actually, you don't have to trust Dylan. You can ask the CBO. Here, let me get a word in edgewise, Betsy. You don't have to trust any of us. CBO was asked the question, what if you eliminated 30% of all tort claims in the country? How much would rates go down? They said 0.04%. Why is that? 48 out of 50 states already have tort caps. The insurance companies take the difference. The problem is not that the money isn't getting saved.
Defensive medicine, it's not just the liability premiums.
But the insurance companies take whatever savings that they get and put it in their pockets. How do you get them to compete?
How do you get them to compete? How do you get rid of the corporate communism that is destroying our country right now?
That's a preposterous statement.
Really? How is that
yes,
a preposterous?
It is a preposterous
you explain to me how that's preposterous.
Politicians in each state that have eliminated the competition by imposing so many mandates and so many rules that in New York State, for example,
hundreds of policies in the state.
It is true.
We have hundreds of policies,
and
but they don't compete on price.
Nobody's competing.
They're all the same.
No one is competing to serve the customer. Everybody's competing to shed risk to the taxpayer. And shedding risk is not capitalism.
I'm not defending the insurance
shedding risk is stealing.
He's asking you how you cap costs. You have an answer for that, by the way?
Yes, I had a very good answer.
Which is? Not
first
tort
of all,
reform.
no,
Doesn't
we
count.
need to educate people
to
eat properly and take care of their health. We've done it with cigarette smoking, and we can do it with obesity as well.
It's in the bill.
Uncontested. Our primary issue is we have...
I'm not going to cut costs by devastating seniors, and that's what Anthony wants to do.
You're going to come here to try to scare seniors. You're in the wrong place.
You're in the wrong place.